So thanks so much for having me. As Kelly said, my name's Alysa, and I serve as the regional coordinator for the West Virginia local partner site of the Mid-Atlantic AIDS Education and Training Center. And from this point on, I'm probably going to call it MAAETC because that's kind of a mouthful. So we have MAAETC shortened for us because it's hard to say that every time. But you'll find all about MAAETC as I go through the presentation today. Disclaimer, we are supported by HRSA, the U.S. Department of Health and Human Services, as part of a grant, and we are 0% financed by non-governmental sources, and contents of the presentation are those of the authors and don't necessarily represent the views of the government. Our mission is to offer comprehensive healthcare workforce education, clinical consultation, and technical assistance, and we want to enhance the quality of HIV care outcomes for people with HIV and communities disproportionately impacted by HIV across the U.S. and its territories. And we want to transform HIV care by strengthening systems of education, consultation, and support, and advancing a unified interdisciplinary workforce. And we want to equip the workforce to meet the evolving needs of patients and clinicians nationwide. I don't have any disclosures today. So the Mid-Atlantic AIDS Education and Training Center, well, I already forgot, MAAETC, we're one of 8 funded regional AIDS education and training centers across the country, and we provide training, consultation, and technical assistance. And the regions that MAAETC covers are the ones in green right there. So we cover Delaware, Washington, D.C., Maryland, Pennsylvania, Virginia, and West Virginia, and we do that to support the National HIV/AIDS Strategy and HRSA priorities. So we are Part F of the Ryan White HIV/AIDS program. So you might know of your Ryan White programs for the other care portions. I know in West Virginia we have Part C, Part D, Part B. Part B is like case management services. Part C and D are both care services that are offered, both federally funded as well. So you might be familiar with that side of Ryan White, but the AETCs, or the AIDS Education and Training Centers, are kind of the education arm. As far as the geographic areas served by MAAETC, you can see on this slide the areas that we covered, the ones that I listed earlier. Here in West Virginia, we're based out of West Virginia University. So we have a subcontract, and we do cover all 55 counties and work with healthcare professionals in really a variety of settings, from large health systems like WVU Medicine to smaller community and rural practices like federally qualified healthcare centers, or FQHCs, and some rural practices, local and county health departments. And this statewide reach really helps ensure that providers throughout the state have access to HIV education, training, updated guidelines, and technical assistance. I want to take a minute to focus on our organization of MAAETC as well. So the MAAETC consortium is really, consortium I think is a fancy word in this case to describe a collaborative network of clinical experts, educators, and trainees across the Mid-Atlantic region. So I have a photo here of, we recently had our in-person consortium meeting, and these are some of the leadership for each of our regional local partner sites throughout those different areas I listed. And we work together to share expertise, resources, and training opportunities, which allows us really to offer a wide range of opportunities throughout our Mid-Atlantic region. And since 1988, MAAETC has been headquartered at the University of Pittsburgh with their School of Public Health, the Infectious Diseases and Microbiology section of it. And I wanted to talk about MAAETC leadership. So our director and principal investigator is Dr. Linda Frank. She really guides us with her years of leadership and experience. And then the MAAETC assistant director is Dr. Ha, and he's also headquartered at the University of Pittsburgh and has been with us for quite some time. So we're grateful to them for their guidance and leadership. But I am here with the West Virginia site, like I said. So our regional director is Dr. Nicole Bryan. She is an assistant professor within the WVU School of Medicine. She's with infectious diseases. She's really so knowledgeable and kind and really great person. And she offers us so much knowledge about many infectious diseases, but she works in the WVU Positive Health Clinic as well, serving patients with HIV. So that is her on the very right of this photo. And then I'm the regional coordinator, so I serve in this role to provide some direction and coordination as far as our initiatives across the state. And then we have Myra Coleman, who's on the right bottom there. She's our program manager, and she helps with a lot of our initiatives as well. And some of our finance stuff that I don't know how to do, so they're very thankful for her. And then moving kind of more onto our clinical side, Ann Bear is the clinical coordinator for the Positive Health Clinic. She's a registered nurse, and she is very knowledgeable and experienced as well, has been in this field for quite some time. So she is an educator for us part-time. And then both Dr. John Gilfus and Dr. Sam Richardson, they both work in the Positive Health Clinic as well as some other things at WVU Medicine too. I'm sure you're familiar with Dr. Gilfus, being that we're on the HCV, HIV echo. I know he does a lot of work with both of those. So he helps educate for us as well. And Dr. Richardson he's a psychologist, or psychiatrist, I'm sorry. And he is very knowledgeable about mental health and HIV and has his experience in a lot of different areas. And then we also have a part-time student worker who's a program specialist, helps us out with some of our data collection and input, things like that. So I wanted to talk a bit about what the goals of the AIDS education and training centers are. I know we have a big name, but what do we really do? So a big part of that is to support and strengthen the HIV workforce. We really want providers to be able to feel confident in their knowledge and skills so that they can deliver the best possible care to their patients. Often in rural areas, there's maybe like a couple big centers where there's infectious disease providers that are the experts, and then there's kind of these pockets of areas where there's not as many people that are comfortable. So we really want to increase the size of the current HIV clinical workforce to some of those other providers, maybe like primary care providers, like physician assistants and nurse practitioners and other MDs, maybe increase the comfortability in treating HIV. We also want to focus on improving outcomes along the HIV care continuum. So that includes helping people get diagnosed earlier with increased testing, helping people stay engaged in care, and achieving and maintaining viral suppression. Make sure they're staying in treatment. And we also want to educate and support the frontline workforce to help reduce new HIV infections. And really, we just want to make sure providers have updated information about HIV when new guidelines come out, if new PEP guidelines come out or new PrEP options are available. We want to provide that information and really allow the HIV workforce to be better equipped to identify risk, provide prevention services, and have resources to connect patients to care if they're not able to offer it. And then we do offer a variety of educational programs, training opportunities, and technical assistance for professionals who care for people with HIV or just those at risk for HIV. And because HIV care is multidisciplinary, we work with a lot of different providers across different roles and settings. So this doesn't just include prescribers, although we love to work with prescribers. It can also include roles like nursing, social work. We even work with peer recovery support specialists who are often out on the field doing HIV testing. Another big thing that we do is spend a lot of time thinking about the really helping teams build their capacity to provide HIV prevention, testing, and treatment services. So if we're thinking about things like building a PrEP clinic or managing other health conditions that often impact people with HIV, like hepatitis C, or things go hand in hand, like mental health services and people who inject drugs, those kind of services for people who inject drugs go hand in hand with HIV. And then the last thing that is listed here is developing the future workforce. So we do that by partnering with health profession schools to integrate HIV education really into their curricula, helping prepare the next generation of people who are going to be providing that those HIV services. So, like I said, in our state, I am seated within WVU Department of Medicine. So we work with some of those professional schools, as well as some other smaller programs like Bluefield State College. We work with their nursing program every year to offer education about HIV and make sure that they have a little bit of knowledge before they're out into the field. And I find this is an area that's lacking in a lot of curricula, or HIV is something that's kind of skipped over, despite the rising HIV rates in our country. I know when I was in nursing school, I remember my professor said something like, "Oh, we don't need to even talk about HIV. It's not going to be on the boards." So we didn't even learn anything about it. And I didn't learn about it until later whenever I was out in the field. So we want to make sure we catch some of our healthcare professionals while they're still in school and while they're absorbing lots of information. We can educate a little bit more about HIV then. So we do have several different program components. So they're grouped into 3 areas: the regional base, ending the HIV epidemic, or EHE, and then Minority AIDS Initiative, or MAI. So Foundations of HIV is the first part of the regional base program that we offer. And really that is introductory HIV education for unexperienced or low experience providers, novice providers, focused on prevention, screening, leakage to care, offering culturally competent care. So that's kind of your fundamentals of HIV, that base level. And then the next one listed there is CEE, or Capacity and Expertise Expansion. So those are a little bit of a higher level of training in the way that they're interactive, and they're supposed to strengthen HIV prevention care and treatment knowledge among those who are already providing HIV services, so among those healthcare teams, versus that foundational knowledge. And then the third one listed under our regional base there is called Practice Transformation, or PT program. And that's where we offer training and technical assistance to support system level improvements at FQHCs, or those federally qualified health centers, and Ryan White HIV/AIDS programs, those funded programs, to really improve the capacity of those programs. So it's kind of more like a one-on-one program that the FQHC or Ryan White program will sign up to be on board with, and it's usually multiple years long, and we work to increase their capacity. So things like being able to start up a PrEP clinic, or getting their providers comfortable with treating HIV and starting like a monthly call to review those patients with an infectious diseases provider, something like that. And then the last one listed on a regional basis called IPE, or interprofessional education. So you've heard this term interprofessional before, likely, but collaborative education for health profession students, graduate programs, and faculty, really just focused on teamwork, communication, and comprehensive care. So we really want to involve different members of the healthcare team, not just siloed into individual disciplines, but physicians working with nurses, working with social work, working all together to provide more comprehensive care for the patients. And although not every site is funded to do specific IPE activities, I would say most of our programs involve an IPE component, because they are interprofessional in nature, when you're providing such wraparound services to patients with HIV. And then another part of the program that we're offering is EHE, or Ending the HIV Epidemic. So that's training and technical assistance just in our EHE jurisdictions, focused on HIV testing, linkage, treatment, PrEP and PEP, and then outbreak response. So we aren't funded specifically in West Virginia to do that because we're not an EHE jurisdiction. Right now, the way those are funded, they're typically in some big metropolitan areas, thinking like DC, places like that. And then the last one listed there is our Minority AIDS Initiative, or MAI. So it's education and technical assistance to improve prevention and treatment experience among minority serving healthcare professionals and organizations. So we are funded to do this one as well here in West Virginia. Although our minority percentages are a little lower than some of our less rural counterparts, we do have some minority populations, and we work with some historically Black college and universities, or HBCUs, like Bluefield State College, to offer some of those MAI programming to individuals and healthcare professionals. So really, you can contact our regional partners across our Mid-Atlantic region for in-person and virtual training sessions. And a lot of the in-person ones are smaller, targeted based on need. I did want to highlight our HIV prevention series that we partner with Project ECHO on. And it's the first Thursday of each month, and at the same time from 12:15 to 1:15. So if you guys haven't been on that one before, I encourage you to join. A couple of our upcoming sessions are on, I think, HIV testing is the next one, and that one's next week. And then we have an upcoming one on PEP guidelines as well. So those are always good, and we always want people to submit some cases to get that interactive factor in there. So feel free to do that. We also offer clinical consults, which is a form of technical assistance. So anytime you have questions about HIV prevention or care services, you're wanting a clinical consult from an expert, feel free to contact us and we can get you some consultation for that. And I'll have my contact information at the end of the presentation as well. This slide is just some of our West Virginia local partner site training programs and collaborations. We've got a few of our educators up here, as well as myself, Dr. Brian, and that picture, the photo right here is in the middle bottom. I'm not sure if you can see my mouse or not, but is our me visiting our practice transformation site up in the Eastern Panhandle. This is some of our partners over at the CAMC Ryan White program. They have a really awesome program with a very involved mobile outreach. That's one of their mobile outreach vehicles that they're in front of as well. And then that's Ann Bear, one of the nurses that I talked about that helps us do some educations on the right. But we have a really great team with many different disciplines that are willing to offer advice and clinical consultation and trainings based on the needs. So feel free to contact us to get something like that scheduled. And then I'd also like to highlight our preceptorship or clinical scholars program. It's a great opportunity for providers who are looking to expand their HIV knowledge and gain hands-on experience. So it combines both a didactic portion and then hands-on experience with that in-person shadowing for a preceptor. So we cover a wide range of topics, including HIV treatment, antiretroviral therapy, prescription, prevention strategies, care for special populations, comorbidities, trauma-informed care. It goes on. And really, like I said, when you're offering such wraparound social services like the Positive Health Clinic, which is the Ryan White program at WVU does, or I'm sure a lot of other Ryan White programs or other places offering HIV services. It is in itself so interdisciplinary. You're getting that aspect of it as well. But we offer this clinical scholars didactic program twice a year live, and it's open to up to 50 trainees each. We have a recorded version as well of the last one that happened in March. The next one's scheduled for September. So you attend that, and it's a 2-day program, and then we schedule shadowing here in Morgantown, West Virginia at the Positive Health Clinic with one of the providers there. And it's been described as very positive and an invaluable experience. So if anyone is interested in dates, I think we just filled up for June, but we should have some dates opening up for July and August and the rest of the year as we go on. And then if you're not in West Virginia and you're in another area, each one of our sites offers the on-site experience following up this didactic session as well. So you can feel free to scan that QR code, email the Pittsburgh headquarters, or contact me directly. And like I said, all the contact information will be at the end, so we can take a look. And then I do want to mention a couple AIDS Education Training Center, AATC resources. So the National AAT Support Center, or NASC for short, we like to think of it as kind of the central resource hub for the AATC network nationally. So it houses free training materials, educational resources, and information about upcoming events. So they kind of combine some of the events from the different regions, not just Mid-Atlantic, and we'll put them on a calendar. So if you'd like to receive updates about new resources and trainings, you can scan the QR code to subscribe to the AATC and NASC newsletters, and they have an app there as well on the left. And then these are just a couple other resources I wanted to touch on from the AATCs as well. The National Clinician Consultation Center offers free expert consultation on prevention care and treatment questions. So that's another way you could take it if you have questions about prevention and treatment. These services are free as well, and you can scan the QR code to access that. And they're open more hours than you would think they are. So feel free to take a look at that for the information details. And then the last one I'll touch on is the National HIV Curriculum. So it's a free online training platform with HIV education and CE opportunities. So It has modules you go through. I've been going through it right now for myself, for my own knowledge. And it's very comprehensive. And then there's a little quiz at the end to test your knowledge and to claim your CE credits. And both of these, the NCCC and the National HIV Curriculum, are excellent resources. So feel free to scan to access those. And I think Kelly has a copy of my slides she'll upload if you want to take a look at it later. Don't have time right now. And then for more information about this or other services of the Mid-Atlantic AETC, you can feel free to visit our website. We have a lot of free webinars and in-person trainings throughout the year. Most of them are free to attend. So that's a QR code you can scan to access our website as well. And then to register for events, that's what the website's going to look like. And that is the page on the West Virginia Regional Partner or Local Partner site. So that's mine and Dr. Brian's contact information if you were to ever need it. And our list of upcoming West Virginia specific events are on that page as well. And there is our contact information too, as well as our headquarters. So thank you so much. And I'm open for any questions, concerns, comments now or later with my, if you want to contact me later too.